Everybody. This is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator, and you are watching Aging Strong, which is sponsored by the Quincy Health Department. Today's topic is on MRC, and you might be asking, what is MRC? Well, today you're going to spend hopefully an hour with us learning about MRC and how that can impact you and how you can be a part of it. So I have two guest speakers today. And the first one is Jessica Bowe. She is the Emergency Response Volunteer Coordinator for the Mass Department of Public Health. And also I have Joshua Tallman, who is Metro West East Coordinator. And they're going to talk about MRC and also their respective responsibilities. So we'll start with Jessica. Jessica, welcome. And also Joshua, welcome. Jessica, tell us about MRC, but before you do that, I know you have a slide presentation. Can you tell us a little bit about how you got into, becoming a part of this MRC group?
Yeah, of course. Hi, everyone. So as Debbie mentioned, I'm the Emergency Response Volunteer Coordinator for Massachusetts Department of Public Health in the Office of Preparedness and Emergency Management, also known as OPEM. I've been in this role for just about 2 years, but before that, I was with the Red Cross of Massachusetts, working in disaster services for the last 5 years. So working with volunteers in disasters is definitely something that I've done very frequently and enjoy. And most recently, the state opportunity and my involvement with the MRCs, I've been covering for my supervisor while she was on maternity leave. So I've really gotten to know the different MRCs and the volunteers in the last couple of months. Just a quick agenda for today. I'll talk about the overview of the MRC program, the Medical Reserve Corps, but throughout the presentation, I'll refer to the acronym MRC. We'll talk about the roles of MRC volunteers, some of the benefits with volunteering, the training, and how you can get involved, and then what those next steps look like. So the state of Massachusetts has 2 public health programs for volunteers. The Medical Reserve Corps is basically our long-standing program. The origin of the MRC program is from 2001 with the 9/11 and anthrax scares. There was a recognized need for organized, trained public health volunteers. So throughout the country, the MRC program, as well as other state programs, were founded. Currently, there's 34 units in Massachusetts. They cover regionally every city and town that you can imagine. A lot of them sit in public health departments. Some sit regionally. It really depends. They're all autonomous and operated locally. So we support them with a variety of funding and admin support using our volunteer database, which I'll get into later. But that is our MRC program. And then our state volunteer program, which is the Massachusetts Volunteer Program for Public Health, also known as the MVP program, is really another federal program that was founded from 2001 that really supports statewide activations. So as we mentioned, all disasters start locally, so we'll engage the local MRC volunteers first. But if they do not have the capacity or they're pressed on resources, the state team and the MVPs can augment those local resources. So those are our 2 programs at the state level. We really have a variety of volunteers. They're not just medical volunteers. They're also everyday, teachers or retired people. So it definitely, there's a role for everyone, I like to say. Our database, so how you can volunteer, it's very simple. I'll follow up at the end with this, with the steps exactly, but we have a volunteer database online. It's called MA Responds. The goal of this was to easily identify and validate licenses and credentials. So if we needed to have volunteers engaged in any type of public health response or emergency, we could quickly organize volunteers and verify their credentials to ensure that they can help and that everything is ran through background checks and whatnot. So our organized volunteer database allows us to communicate with the volunteers, but also check their credentials and basically manage them all in one place. All of the units use this as well. So if you are interested, I will share the link and more information at the end, but just a quick note about our database. So in our system, we currently have just over 12,000 volunteers. We have a lot of dually affiliated volunteers. You can see just about half of the MVP volunteers are also MRC volunteers. So really that shows us, everyone's looking to help locally, but then many people have raised their hand and said they can support their neighbor or statewide disaster responses in the Commonwealth. So a little bit more about the background of the MRC program. As I mentioned, it was born out of the 9/11 and anthrax scares in 2001. It's been a longstanding program, especially in Massachusetts. Our first unit, I think, was established in 2002, and our most recent unit was established in 2022. So it's ever evolving, ever changing. We have volunteers from diverse backgrounds. They support a variety of initiatives from public health preparedness and training to response efforts such as sheltering, registration, canteening, feeding in any type of disaster situation as requested by the community. We work volunteers with public health agencies, local governments, and nonprofits. And again, the MRC can do a variety of things. From preparedness efforts to response during public health emergencies and crises. I mentioned there's 34 units, just over 10,000 volunteers. They are, as I said, fully autonomous and locally managed. They sit within local health departments or regional planning agencies. A few sit in hospitals, and then some also sit in nonprofits. And as you can see, the map here shows the different size and structure of the MRCs throughout the state. Just a quick note about how MRCs have supported communities. So they have volunteers have recently supported clinics for the migrant responses in Massachusetts. They have some units have volunteers who are trained as translators, so they've assisted in that way. Others have supported the registration and sort of the flow of the clients and, helping families go from agency to agency. So it really depends on the need and the operation, but we do see them engaged from everything with public health, education, and outreach to actual responses and working in the field. As you may have been involved or may have heard, the MRCs were involved during the COVID-19 response. Many did vaccination campaigns, contact tracing, and other health literacy and response efforts. It really does vary throughout the state. And then just to summarize some of the things I mentioned that they've supported in shelters specifically, interpreting, vaccination clinics, registration, canteening, line support and management. So really just filling in whenever there's a need, whether they are trained medical professionals or a general volunteer looking to support everyday tasks.
Can you just briefly describe what each of those line mean for those people who might be interested in learning a little bit more what those topics mean?
Typically, if we have a clinic, we'll have volunteers that may be trained to do health assessments. So asking the clients, depending on if it's a flu clinic or what type of clinic it is, how they're feeling. They may be doing some monitoring after vaccinations or testing. They may be doing other medical related tasks or support, such as, filling out paperwork, or I've seen MRCs filling out the labels and putting them on, the bottles and supporting in those ways. Interpreting services. So we often work with clients from different countries, have different backgrounds. So we try to offer a range of translators. So that is another way. I've seen recently in the medical clinics, volunteers really working with each individual family as they go throughout the clinic or the work authorization center, ensuring that they know who they're talking to and providing any translation services as needed. Vaccination clinics, it does kind of range from whether it's passing out food and drinks and monitoring, the crowd and answering questions, kind of being a greeter or an ambassador, to actually, doing more medical specific tasks in the clinic if they are trained. Line support and management, that's pretty straightforward. If there is, helping families, giving them, entertaining the small children, ensuring that they, have their questions answered for the day, know, who's offering what. For canteening, that's basically assisting with food and beverage if there is any snacks or having a table, serving meals, things like that. Outreach and education. So the MRCs recently at those clinics had to inform families whenever there was, a clinic being offered or other services, so they could do outreach in that way. But more generally speaking, it may be partnering with the local health department and putting up flyers or sharing information with, different communities about different initiatives that the health department or other services may be offering. For data collection and reporting, that depends on the situation, but volunteers can generally, support with data admin. They can call down and collect information, and usually many are comfortable with computers and kind of can support in different ways. So just some benefits. MRC volunteers will be trained and dedicated. They oftentimes have taken training in cultural competency. We can support with resource augmentation and then also community outreach and engagement. So it depends on what you need, but there usually is a way that volunteers can support you or enhance your services. So just to speak to some of the training and preparedness that we offer, so there is a wide range of online trainings available. We also try to offer in-person trainings. It does depend on each individual unit in the region, but we have been offering a annual in-person training day for public health volunteers. So we'll be continuing to do that in the spring this year. So there is many opportunities to engage in training, whether it's online or in person. And then we are looking to offer more specialized trainings. We don't yet have a calendar out yet, but we will be socializing that and more opportunities as they come up. So how do you get involved with the MRC? It's a pretty straightforward process. You can go to maresponds.org to create a profile in our volunteer database that I mentioned earlier. The next step after creating your profile is to download the CORI form. That is your background check, the criminal offender record information form. That form needs to be verified by your local MRC leader, or you can go to a notary and then essentially send that into myself, which I will process it. These directions are all written out in the form, but if you have any questions, you can always reach out to me. And then our process, as soon as we receive that form, we'll process it and then update your in the system so you can volunteer, and we'll connect you with your local leader. So if you have any questions about who your local leader is, we do have a website that I will provide I can put it in the chat box or share it, but there's basically a way you can look up your local MRC unit, or you can reach me directly at jessica.bo@mass.gov. And then I will be turning it over to Josh to talk about one of our local units, the Metro East MRC unit.
Thank you, Jessica. Josh Tallman here. I am the Metro East Medical Reserve Corps Unit Coordinator. So you just heard from the state level leadership for our volunteer programs. And I'll talk a little bit more to, as Jessica mentioned, these units are fully autonomous. So I'll speak to some specifics about one of the major units that's in the Metro Boston area, Metro East, which includes Quincy. This is a training that we have for new volunteers. So this is just a little piece of orientation, but I think it'll help cover some good material here when talking about Medical Reserve Corps. And a little background for myself before Debbie steps in and asks me how I got into this. I just took over the Metro East MRC role a couple months ago. This position was actually gapped for a couple years. So you'll see we have 19 communities that are captured in the Metro East MRC. And so for a couple years, they didn't have a dedicated unit coordinator position. So part of what I've been doing here is sort of revitalizing and reconnecting with our volunteer base. So this is, my ability to be here talking to you guys is a lot of fun for me. This is what I'm doing in the coming months and the coming year is really just re-engaging our community and advertising this program as much as I can. In my past life, I spent 8 years as a naval officer working on ships across the globe. I just separated and moved to the Boston area with my wife. And, finding positions like this to be involved in public health and with our communities are things that I'm very passionate about. So this has been a really good fit for me. So anyways, the Metro East MRC, a few objectives here. We'll talk a little bit about the program. I'll try to talk more about, Metro East specifics. We'll talk about a couple more activities. I know Jessica did a pretty good job of highlighting some examples of activities. So I'm going to talk about some recent activities specifically that Metro East has done. And then when you see the MEMRC acronym, that is the Metro East MRC. And so we'll shorten that up. I guess that's an initialism, not an acronym, MEMRC. So when you see that, that's Metro East there. We include this in our intro presentation because you've probably seen and heard enough acronyms and initialisms between me and Jessica in just 20 minutes, right? So this kind of breaks down, not that it's critical for a volunteer to understand, but the Medical Reserve Corps federal program falls under the Department of Health and Human Services, and within that, ASPR, the Assistant Secretary for Preparedness and Response. What's important for us in Massachusetts is that it's managed by the State Department for Public Health, MDPH. And even within that, MDPH's Office for Preparedness and Emergency Management, Massachusetts State Public Health, that's who manages this program at our state level. And then a couple other acronyms at the bottom that I won't talk to today, but if you've seen those before, NIMS and ICS, those are command management systems promulgated by FEMA, the Federal Emergency Management Agency, as a framework for how our communities and our stakeholders and local governments work together during emergencies. Another quick background, after September 11th, 2001, this program really got established. It's been around for over 20 years in Massachusetts. In disasters, what I want to highlight here is the reason it can be valuable to be a part of an MRC is you're affiliated with a vetted, verified, credentialed group. And so, me as a unit coordinator for 19 communities, I'm in direct contact with our public health leaders in those 19 communities. So what that means is with our volunteer base, with our registered volunteer base, I can be a belly button that our local public health departments can rely upon for, a guaranteed vetted volunteer base to be able to be mobilized or utilized for official purposes, for that community. And so, if you think of volunteering, this is a challenging piece for people trying to get any group together to volunteer and commit their time to something. But because we're a vetted program that's tied into the public health infrastructure, we really eliminate a lot of the headaches for any community to try and set some type of large volunteer process up. And moreover, because we are, a dependable and consistent volunteer group, we do end up getting a lot of volunteers who do pretty routine mobilizations with us, who go to our trainings, who become, pretty capable, pretty well-trained volunteers within our organization. So there's a few reasons that it is really really beneficial for both the volunteer and for the community to be part of an affiliated program like a Medical Reserve Corps. Our mission piece here, I will say there isn't really a single definition that captures what MRC volunteers can do. Even in my couple months of being with this program, being the unit coordinator, it is, for anyone who's been around public health, the solutions are kind of limitless in how creative you can be with them. So yes, we have a lot of credentialed medical professionals in our volunteer base, but we've also got a lot of people who just like giving their time and like supporting their communities in any way that they can. And lo and behold, a lot of those members have gotten, you know, some level of medical credentialing, whether it be stop the bleed, CPR type training, or something else, just by being a part of our program and participating on an annual basis. So, you know, broad definition here, but really, I would say the things that MRCs do is almost limitless. So by the numbers here, we kind of saw some numbers earlier as well. I will say for Metro East, we capture a lot of the Metro Boston area with 19 communities, over 800,000 people within our catchment area. So those are the numbers I'll highlight there for you. And then I'm working on getting an updated map of this. MRCs sometimes change jurisdictions over time or evolve or branch off into other ones. So the baby blue and the yellow of Newton there, those are our 19 communities for Metro East. So you can see we kind of, you know, we encircle a large portion of Boston there. Arlington, Belmont, Braintree, Cambridge, Chelsea, Cohasset, Everett, Hanover, Hingham, Hull, Newton, Norwell, Quincy, Revere, Scituate, Somerville, Watertown, Weymouth, and Winthrop. And if I mispronounce one of those towns, I'm from Ohio. I am learning Massachusetts as I'm here. I love it here. But please be kind if I mispronounced one of your towns. So 19 communities, right? And I think if you think back to that map you saw of the state that Jessica brought in, you know, and even just within this one, you can see that Brookline, a single community, has their own dedicated MRC. And then we've got Norfolk County 8, which has 8. We've got 19 communities. The MRCs really are diverse in how many communities are involved with them, what community is the actual host for that MRC. And so you can see with Metro East, we have a large area, a large population. We have over 1,000 registered volunteers with an incredibly diverse range of credentials and capabilities. So we've got a lot of resource. One of our challenges is being involved and being engaged across this entire catchment area. And so that's one of the things I'm working on. And should you decide to be a member of your local MRC, and if you join the Metro East MRC, you can expect to hear more from me in the coming year as we try to really make sure we get a whole region engagement here with this MRC. But we are historically in Metro East a very active MRC, and what we're really focusing on moving forward is ensuring that we remain active across all of these areas. And then I guess last thing I'll highlight that maybe isn't too important for the volunteers, but Jessica mentioned that a lot of our volunteers are dual members of MVP and MRCs. I will say also within this MRC program, when you register on MA Responds, you can be a part of multiple MRCs. So being a part of Metro East doesn't exclude you from being part of Norfolk County 8. And moreover, I will tell you that this Region 4B, every community here highlighted in Region 4B, we all work very closely together. So myself and the other 2 unit coordinators in this region, we really do operate almost with a single mind when we have larger regional projects or opportunities for our volunteers.
Joshua, before you move forward, I'm just a question, I guess, elephant in the room.
Do it.
Why is Metro East so covering so many different towns and some are in the North Shore? If you live in the Quincy area or in the South Shore, south of Boston, you consider yourself a South Shore person, pretty much. And if you live north of Boston, you kind of consider yourself a North Shore person. Boston's the cutoff.
That's a great question. And that's actually one, you know, as I've come into this position, that has given me, you know, plenty to think about. I will say a couple things. Jessica mentioned that our MRCs are autonomous and they're created, you know, to function and serve their communities in the ways that are right for them. In this circumstance, what I can tell you is that creating an MRC requires a community to step up and say, I want to host and manage this autonomous program. So there's legwork in that. And the way that we can see this inner ring of the Boston metro area has carved out is that many of these communities, and Metro East has actually grown and absorbed some communities over time because it's an established functioning program. Many of these communities have decided to pool together so that management piece can be one central manager. Towns like Brookline like having full control over their local MRC base. And that's okay too. It comes with some management challenges. And it requires you to also be able to reach out to the communities around you for maybe larger activations or anything that's beyond your borders. So what I can tell you is that historically, this is, for the most part, the way Metro East has been set up and has functioned. And so what is it? Historic norms have kind of led us to where we are today. So yes, it is a large area. I'm probably not going to get volunteers from Scituate showing up to a warming shelter in Revere. But like I said, we're trying to expand our training opportunities and our volunteer opportunities so that there are things in your neighborhood or nearby town next to you within, a 6-month span to keep you active and give you opportunity to be engaged with your community. Some unit activities here. We talked a lot about unit activities with Jessica. I will say, every year vaccination clinics happen. And whether you realize it or not, your town probably hosts its own vaccination clinics with its public health leaders. Some towns are able to run these with their own public health nurses. A lot of our towns in Metro East request volunteers from our Medical Reserve Corps to support these things. So this is a routine annual operation that our MRCs are involved with in Metro East. Emergency sheltering is, typically an emergency management led thing. So from a state level, you can think the Massachusetts Emergency Management Agency. However, as Jessica mentioned before, we had a work authorization center and some other opportunities for volunteers with regards to sheltering and our immigrant processing in the state right now. And while a lot of those exercises, a lot of those projects are being led by state emergency management leaders, they still share the opportunities with us in our MRCs to broadcast to our volunteers should they want to volunteer for those things. In Somerville recently, we've really focused on, something that's a little bit more public health centric is our warming centers over the winter as we get into these cold months. A lot of our towns are finding that, we need some place for our unhoused populations to survive the really cold nights because when the temps get down below about 10 degrees, it's those people on the streets end up trying to find places to go. So we've got a warming center getting set up in Somerville and at the end of the month. And so we did an educational forum last month for our community to help educate and connect them with volunteer opportunities for that warming center. And so that's a little bit more of a public health centric opportunity and something that tends to be a pretty fun way to engage your community because a lot of those volunteers and a lot of the people that you interact with there and community stakeholders and the people that you're serving, those warming centers end up being a pretty fun social way to connect with your town or your city in the cold months here. And I can tell you our example for running those warming centers has been Malden. Malden has had a really, really good program going for several years now. And it has become a really good staple in their community that a lot of people volunteer at and have fun with every year. So That's one of the recent things that we've been looking at and really trying to connect our volunteers with.
That just perked my ears when you said warming centers, knowing that it's, becoming colder and colder. And I'm seeing a lot more people who are homeless just wandering around. And I wonder, what's going to happen to them with the cold weather. So unlike shelters where homeless people can go there for dinner, spend the night, what happens in the warming centers? Do people stay there 24/7 until the weather is nicer? I mean, is there a cutoff when they can no longer be in the warming center for that moment so that other people can have a chance to
Yeah.
their space? How does that work?
So Debbie, those are good questions. And those are some of the questions we were really trying to answer for our communities this past month when we did an educational forum. And I'll try not to totally derail here, but I will take this opportunity to talk for a few minutes about it. Specifically, a warming center gets established in the winter months in areas of need as it functions similar to a shelter where you typically check in the evening, get a warm meal, sleep for the night, and then you're back out the next morning. So you arrive in the evening, leave in the morning. So functions similar to a shelter. It is typically, there's a couple different types of warming centers you can set up. There can be pop-up where you get an indication, an alert that weather's going to get severely cold, and you pop it up for a week at a time or so. Those are very challenging to coordinate for local public health leaders. So the preference is to set up to just determine, hey, January through March, our winters are coming later now. Let's get our most needed 3 months covered. Set up a 24/7 warming center, and typically in a town, you're talking about beds for 10 to 20 people, and your target population for this, it's the unhoused population, but specifically, there is a piece of that unhoused population that is comfortable living outside and that prefers to and will continue to do so until it gets down to about that, maybe 10 degrees, maybe colder. And they really begin to understand, they know when they need to come inside if they absolutely need to. So the warming centers are really more for that specific population. It's, a little bit less for people that are coming to shelters every night on a 365 basis. And I think what we've seen with some of our examples of this in the past few years in our Boston metro area is it becomes a resource that's really nice for everyone involved. If you've got local law enforcement, picking up an unhoused community member, it gives them a place to take them. And, for a lot of these unhoused folks that are coming over to these warming centers, there's a really positive stigma that's being attributed to them. So they like going there and connecting with their other community members. Again, these aren't the people that seek these out all the time, but knowing that resource is there in a time of need is a game changer. And like I said, every volunteer I've talked to and every community leader that's been involved with the warming centers that we've seen, really positive experiences and stories from that. So, I can tell you in Malden, a lot of their government employees and elected officials go volunteer at their warming center, and they've got a really good culture over there. So, really in general, try to break these stigmas around public health projects like a warming center, because it does a lot more good than bad, to be certain. And I think this we talk about the NIMBY, not in my backyard, feeling that a lot of our towns get when projects like this come up. And so this is another example where I would say this is a big win. People love it. There's a lot of positive energy around it. So if I can just do my 5 minutes of trying to project the positivity of a warming center, in an area like New England, that would be it.
Again, I've never heard of it, and I'm just so happy to hear about something such as that, and
Yeah.
hope that more
In the
do it.
I think in the Cambridge Somerville area, we're looking at there's about 30 community members is roughly the number between those two towns that we're really trying to make sure we capture with these warming centers. And they go out every year in January, and they do a point in time count to help keep track of our unhoused population. But these folks out there, they're not strangers. Like, your community leaders and community members, they know them. And so these are folks that live in your towns and are, contributing community members. A lot of them work too. So it's fun. It's a fun thing that I had not been connected with before in my life, and has been enjoyable. So baseline expectations for our volunteers when they go out, being safe, and we'll give you, when we ask you for a mobilization, you will see from me, as a registered Metro East volunteer, you will get contacted via email, unless it's a true emergency that's time sensitive, in which case we'll text you or call you. But for 99% of mobilizations, you'll get an email with details about a volunteer opportunity, and there will be, supporting documentation such as a job action sheet that describes the scope of work that you're going to be doing. And then, should you volunteer, right? And it's totally up to you whether you volunteer to show up for something or not. We just have some baseline expectations for our volunteers to essentially conduct themselves, professionally as a representative for Metro East, right? If you answer the call for Metro East when you show up, you're not just yourself as an individual, you are a team member of Metro East, so you represent us. The do not self-deploy piece here is explicitly, don't self-deploy as an MRC member, right? If there's flooding or something in your town and you're helping out neighbors and things like that, that's fine. But don't go out advertising yourself as, an MRC member if it's not affiliated with an official deployment with us. Okay. Mentioned this, 99% of communications will be via email. In certain emergencies, we will have an escalation format of contacting you.
I really appreciate that, never self-deploy, because, some people, oh, I'm trained, I can do this, but they need to remember there's a chain of command, and they need.
And I think, it's good to, support your neighbor and something like that. But this self-deploy piece really is for, don't, storm to the center of town where there's like a disaster going on wearing your MEMRC shirt and say that, talk to the paramedics there and say, where do you want me? Right. That's the kind of stuff we want to avoid, because that kind of activity actually can worsen emergencies. So anyways, the skills that you can get from training with our MRC can be helpful for you in your community and for yourself in making it through emergencies on your own. But that is a separate piece here from the deployment. Okay, so my contact information here, that's my cell number. You can contact me anytime if you're interested in the Metro East MRC. That is our email that you can contact us through. We are on Facebook and LinkedIn. I'm working on getting those to be a little bit more active in the coming year, but we'll try to share information on those social media outlets as fitting.
As far as the cities and towns that you are responsible for, are they all pretty much at an equal rate of preparedness training? And are there some that's a little bit lagging? And what are the plans this year to kind of help elevate everybody so that way everybody's on the same page?
So I appreciate the question. I think when you're talking about cities and towns preparedness, it's a little separate from the MRC. You know, cities and towns find a way to support themselves, and some of them use the MRC a lot, some of them don't. It's okay if some of our towns have gotten used to not using MRC volunteers for things. Some of them have more public health resources. You know, and it doesn't mean that, you know, the MRC there, you know, isn't prepared or anyways. But for me, for Metro East, in the coming year, what we're going to be doing specifically is going out to our communities and hosting some CPR and stop the bleed trainings to get people certified for that. So those will be free volunteer opportunities to get trained up in that way. And those will be in-person opportunities to help meet a few community members, right? Maybe find some other potential volunteers, get the word out. And then in the second half of the year, we've got a little bit of grant money set aside to facilitate some more niche training, pending what we start hearing from our community. So this first half of 2024, we're really looking at getting out and engaging in some baseline CPR life-saving skills. And after that, and hearing some in-person feedback, we'll come back to, you know, our South Shore, North Shore, sort of this Northwest pocket around Boston, make sure we're engaging those areas and see what else we can maybe provide. What's a need or a want from our volunteer members. So when I think of preparedness for my MRC, I'm thinking of what are my volunteers asking for? You know, what is it that they want to learn and train on and be a part of? What opportunities do they want to be able to volunteer for? So that's sort of where my mind's at.
Great.
And I'll just add that, so we do have, as I mentioned, the MRCs need to cover all cities and towns in Massachusetts. We know that some are more active or engaged than others. So we do offer strategic planning, and we have now done that twice with both the western part of the state and the units, which involved convening all of the stakeholders, which would be the health departments and anybody who wants to engage in MRC in their town, as well as the unit leaders. So we offer strategic planning. We did that as well with the region, the Boston region, basically. So we offer strategic planning, but we also offer training and other opportunities. We have an annual in-person volunteer training day just to ensure that they get at least one. It'll hopefully be a roadshow in the years to come. We have a grant that we just received specifically for developing training plans and opportunities for volunteers. So we'll be socializing a training calendar, as well as identifying the needs based on what the unit coordinators and the volunteers are looking for, but as well as the communities and, just trying to balance what our priorities are as a state. So more resources to come, but essentially our plans are to offer opportunities for training and then promote online and other resources for self-paced training.
Great.
And I might add, Debbie, again, for perspective, because you're hearing a lot of information from us. If you become an affiliated member of an MRC, whether it's Metro East or another one, what you can expect is you'll get emails about mobilization volunteer opportunities, but you're also going to be a part of a network that's getting emails about training opportunities, whether they're set up by the state, by your local community, whether a neighboring town is setting up a shelter or something like that. So you really become a part of a network that's tapped into a lot of information for this type of engagement, whether it is training or volunteering.
So there's initial training once you sign up to become a volunteer, and there's ongoing training. But is there like a baseline mandatory training that's required for all volunteers to have every year?
That is a great question. We are as I mentioned, the grant that we applied for earlier, that is one of the outcomes, is to have a recommended training plan for all volunteers. So currently, the short answer is no. We have recommended trainings, which each unit, it may be required at the local level to take an orientation or to take ICS Incident Command 100 or Psych First Aid. Those are some of the recommended trainings that you typically see in disaster world. But we are working on putting together a training curriculum and recommending that units require volunteers to at least take a couple of basic trainings, but we are not there yet. That is just the the hope where we'll go in the future, and then in the coming months.
Great, great. I'm glad to hear about the psych first aid. I've taken the mental health first aid courses, and I've certainly have taught enough Stop the Bleed classes to different MRCs. And what I've been hearing a lot of from other Stop the Bleed instructors is they combine Narcan training with some other Stop the Bleed training. So I'm not sure if that's something you might want to add, Josh, to some of your training is Narcan.
Yeah, it is in the game plan actually for some of our baseline trainings here, especially because, as time goes on, Narcan is becoming more available from our public health leaders in our communities. So they want us to engage with it as much as possible. And it's now easier than ever to use. So yeah, you can expect that to be part of our baseline trainings that we offer.
Right, great. And you talked about psych first aid. Is there also an element in the grant that you have to train the volunteers with trauma informed care?
So we didn't specifically call out all the trainings. We're going to be doing a training assessment. So that'll involve surveying the volunteer coordinators, the MRC volunteer coordinators, as well as the volunteers themselves. We do this currently, but we're looking to do a more formal analysis to really identify what our priorities are and what the topics will be. But yes, I hope that those come up, but we will be balancing out, what the requests are and, what the appetite of the leaders and the volunteers are with what resources we know is a priority. So yeah, we haven't yet set that up, but I hope that it's included.
Yeah, I hope so too. So much need for that. So can you just share with all of us some of your experiences as far as more recently, I guess, the COVID-19 time? How were you able to experience the fullness and the benefits of MRC during that time? What did you see? What did you notice? Any lessons learned? Anything that you might want to share with us? So that way, for those who are thinking about, oh my gosh, MRC, I can volunteer. What would that look like for me should a crisis similar to that arise?
So I can take this first. So during the pandemic, I was in a different role with the Red Cross, but we worked very closely with the MRC volunteers. I will say that during any disaster, you always, the biggest lesson learned is I wish I had these relationships already established. I wish I had taken my training beforehand. So I'm not just, walking into this and trying to cram or trying to, trial by fire. So the biggest lesson for me was always make sure, you're regularly providing volunteer trainings and opportunities, whether that's ICS 100, which is a fancy way of basically how does the government work together during a disaster? So how the volunteer agencies coordinate with the state agencies, and what is, the general cycle of a disaster, as well as how, each agency works together. So for me, the biggest piece was training, making sure that there's training opportunities, making sure that we're building a robust volunteer workforce to really engage in the disaster. And then it's also, going out and meeting your neighbors, working with your public health partners and the community to really establish those relationships, because during a disaster, your leaders are going to be, their phones will be ringing off the hook. They're not going to answer random numbers they don't know. The thought is that you've built a relationship, you've established, what support you can offer, or, what maybe as your volunteer, what your expertise is. And then you've already, had those conversations with your supervisor. You can kind of set expectations with what support can be offered. So it's really just about relationship building in the preparedness cycle of the disaster. So that's really before the response even hits. Mm-hmm. And then back, making sure that volunteers are, your feedback is collected, and that you're always collecting those lessons learned. So the next disaster, it's even more smoothly.
Thank you.
Yeah. I don't have too much to add to that. I was deployed in the Middle East during 2020, but I will say Jessica pretty much hit it on the head as far as, again, we're a piece baked into the public health infrastructure in this state, right? And so if I'm thinking public health, I'm really thinking of community connections, supporting one another, preparedness and planning, right? That's how you succeed in a crisis. And so I think Jessica really hit that one spot on.
Mm-hmm. Thank you. So Can you just clarify for the viewers, where does the American Red Cross fall into this, like the whole umbrella of volunteerism for public health and disasters? Where can you just share with us the different volunteer organizations so that way people don't start getting things confused?
Yeah, so I like to say every agency has their, specialty. So that is the main important piece of establishing those relationships before the disaster is everyone learns, what you can bring to the table and you've identified what the gaps are. So for example, the state has established that Red Cross typically has the capacity to support managing shelters. So as Josh mentioned, MEMA, our state agency, may operate the shelter, but before it goes to the state, it always starts locally. So you think about, the local community may not have emergency management or city personnel working overnight. So that's where the Red Cross could come in and they would do shelter managing. They are trained to really provide unique services. They do have trained medical professionals for mental health and, psychological supports, as well as spiritual care. But the MRCs can support in a different way. So I'll get into that next. But basically, Red Cross, think about like shelter management. They do have specific areas that they, if requested, they can offer those supports, but they typically own kind of the sheltering piece. And then when you think about Medical Reserve Corps, that is, the community could request them specifically to support, whether it's a piece of the sheltering, such as registration, or supporting with, an ambassador or greeting. They also can support medical specific needs. Maybe it's working with, if it's basically like if the clientele has, medical equipment that they need support with, or if you need nurses to kind of do some monitoring, you may request more trained medical professionals. So that's where the MRC specialty can come in there. But we also mentioned we don't just have medical professionals in the MRC. So that's where that overlap with, registration or canteening. Salvation Army is another organization that has volunteers that work in the disaster space. There's a number of them, but they typically do, they'll source the feeding and, the meals and all that. They may require volunteers extra support to help distribute those meals, but they'll do the cooking and preparing or sourcing. So every organization has their kind of specialty. MRC is either, a wide range of general volunteer services. Will work hand in hand with emergency management and other volunteer organizations to really divvy up who's doing what. But essentially, it depends on the request of the community and what that individual disaster looks like.
Very good.
And
Thank you.
I think to add on to Jessica as well, you'll find with Red Cross, Salvation Army, typically that, in a disaster, when communities or states request those resources, they will provide them. For our MRCs, we really community oriented means that we do a lot of stuff that might not be for emergencies. But I would say your annual flu clinic is not an emergency, right? We might also reach out to our volunteers to help staff a summer festival or something like that, just as someone to, set at a tent and welcome people or something like that. So there is a wide range of things that the MRCs can get involved with. And if we think back to, how do we get prepared? Well, it's by making connections and being involved. So even these non-emergency things that our MRCs do play a key piece into understanding and connecting and being a part of our communities.
All has to do with public health and safety.
Mm-hmm.
Yeah. So we still have a few more minutes here. So can you just give us some ideas on, the type of people that you want to see more? You mentioned medical personnel. Do they have to be retired? Can they be working right now and still want to be a part of this, public health? What type of people are you looking at? I know volunteerism is so important.
Yeah, I mean, I'll just lead off since I'm the unit coordinator. The folks that I'm really trying to increase engagement with this year are one, people from the North and South Shore in particular. So Quincy, hello. Two, a younger demographic. Our average age tends to be over 50, which is okay. And you find a lot of time, for the retired population, they do have time, and this is when they think about volunteering. But I think engaging a spectrum of our age categories is important. It's okay if you're retired from a medical profession. It's okay if your credentials aren't active anymore. You know, what you do have will get verified when you register as a volunteer, and you don't need medical credentials to be with us. And I will tell you right now, in this state, we are looking for bilingual skills everywhere. In particular, obviously Spanish is always useful. Portuguese is big in Massachusetts. And right now, Haitian Creole is critical, So if anyone's out there in your community and you don't realize that this skill, and you have these bilingual skills and you don't realize how much of an impact they can have, this is a great resource to tap in and figure out how you can support your communities in your state.
That's good.
I think you nailed it. I would just add to both the youth and the bilingual volunteers that we're also looking for, young professionals and adults. I think it's the perfect opportunity of volunteering to kind of get your foot in the door if you're interested in the public health space, or maybe just a way to kind of join a bigger community, meet other people. I think that, we do have a lot of retired volunteers, and we always welcome, people from all walks of life, but we typically see our demographics are a little bit older. So I would like to see more younger adults sort of if they have the time to really engage in volunteering. I think it just opens a lot of doors for you that you may not have otherwise.
Thank you. So we're almost at the top of the hour. So I really want to thank both of you for sharing with us this important organization, and I'm just so grateful that it's out there, and I wish MRC so much goodness and success in the coming years, because I just totally believe in it. So how can people get in touch with you once again, and any one particular topic or point that you want to hammer in before we end the program? Jessica, we'll start with you. How can people reach you, and what's that one thing that you want people to kind of take away from this talk?
I would just say start with my contact information. Jessica Bowe, BOWE @mass.gov. And then if you're looking to volunteer, you can go to maresponds.org. And that is how you register and create a profile and download the query to be processed. And then I will say the most kind of important thing is the volunteering is for everyone. There is no requirement for engagement. You don't have to commit to a certain amount of shifts per month or per year. It's one of those things that's ready for you when you're ready. So we like to say, ready when the time comes. If a disaster occurs, just think you're already vetted, you're already in the system. And if, something happens in your area, you can easily get engaged. I just like to remind us back to the explosions in the Merrimack Valley. We had a lot of volunteers who were spontaneous and raised their hand and wanted to support in the wake of that disaster. But there were a number of volunteers who were already in the system and credentialed, who hadn't been engaged in years, and then came kind of out of the woodwork to step up and support their community. So we always welcome that. I will say there's a spot and a role for everyone. So no matter if you're medically trained or not, we would love to work with you and use your talents. Thank you.
Thank you, Jessica. And Josh?
Yeah, I don't know. I posted in the comments just a reminder on the ways to contact me at Metro East. I don't know if that gets shared when we do this recording, but Metro East MRC at town.arlington.ma.us is still our email. And then that's my personal cell number, 216-533-6014. You can find us pretty easily by Googling as well for the website, metroeastmrc.org. You can contact me anytime. If you're interested and all this information is challenging, shoot me an email and I will give you the couple of steps necessary again to get that query form filled out and get you with us volunteering. Please, it's why I'm here. Like we said, it's all about connecting with our community members, and the first step is just reaching out, right? So I would encourage you to do so.
Great, thank you. Well, I want to thank you both, Jessica Bowe and Josh Tallman, for being a part of Aging Strong. And I want to thank the Quincy Health Department for continuing to sponsor this program. Until next time, everybody stay safe. Bye-bye.